This is PediaCast.
Welcome to PediaCast, a pediatric podcast for parents. And now, direct from the campus of Nationwide Children's, here is your host, Dr. Mike.
Hello, everyone, and welcome once again to PediaCast. It is a pediatric podcast for moms and dads. This is Dr. Mike coming to you from Nationwide Children's Hospital. We're in Columbus, Ohio. It's episode 559. We're calling this one Clinical Pathways Enhancing Child Health with Science. I want to welcome all of you to the program. Before we get to clinical pathways and what they are and why they are so important, I just have a public service announcement for you here real quick. And that is, it's kind of a tough time in the world right now. We came through a pandemic together and you sort of hope for, some easy living, a time of peace for a little while. But that's really not what we have. We do have wars in multiple places that are impacting millions of people, natural disasters, including early season tornadoes and floods and volcano eruptions. There's actually 84 wildfires in 13 states right now that are ravaging millions of acres. And all of this shows up on our television screens and our computers. And our kids hear about all of these things on those screens, but also at school. And so this is my occasional reminder, we have talked about this before, to regularly check in with your kids, regardless of their age, whether they are young elementary school age children or your teenagers. Keep open those lines of communication and ask them what is on their minds. What are they hearing? What are they seeing? What are they reading? What questions do they have? And how can we as parents best support them? You may not have the answers to their questions. There may not be good answers to their questions. You can at least help them think through the things that are concerning them. You can help them find answers and, have a discussion and talk and support. Of course, we want to do this in an age and developmentally appropriate way. So the way that we talk about a war to a 7-year-old and a 17-year-old are, of course, going to be different. But the point here really is to check in and to see how they're doing. And in the face of disasters, whether they are human-made or natural disasters, there are plenty of them happening in the world right now. And these check-ins are really important. And if your child experiences anxiety or sadness, address those things and make sure you get them the help that they need. And often the first step in doing that is just touching base with your child's doctor, especially if you think there are mental health concerns or you think that maybe they need more help and support than you are able to provide. And speaking of that, make sure you get help and support for yourself, because we are going to be able to support our kids best when we ourselves as adults are also well supported. So really important things to keep in mind. As we move on, we are going to talk about clinical pathways today, and there's sort of like recipes in the medical world. You have a particular disease process. Oh, we need to follow these steps. Or you have this set of symptoms. This is the pathway we need to go down to figure out what is happening. So they help to standardize care. They also incorporate the latest evidence, and they are updated and changed as we learn more. So as evidence changes, clinical pathways can also change. They help medical trainees learn best practices, they improve health outcomes, and they increase patient and family satisfaction. But how are clinical pathways developed? Whose job is it to create them and evaluate them and update them? What sort of pathways are we talking about? And how rigidly should they be applied? And how exactly do they improve efficiency and help reduce costs? We'll answer all of these questions and more as we consider clinical pathways. And in our usual PediaCast fashion, we have a couple of terrific studio guests who are going to help us as we consider clinical pathways. Dr. Berkeley Bennett is an emergency medicine physician, and Dr. Gerd McGwire is a hospital medicine physician, both of them at Nationwide Children's Hospital. Before we introduce our guests, don't forget you can find PediaCast wherever podcasts are found. We always appreciate when you leave a review wherever you listen to podcasts, and we love connecting with you on social media. You'll find us on Facebook, Instagram, Threads, LinkedIn, and Twitter, or X. Simply search for PediaCast. Also, don't forget we have that handy contact link over at pediacast.org if you would like to suggest a future topic for the program. Also, want to remind you the information presented in every episode is for general educational purposes only. We do not diagnose medical conditions or formulate treatment plans for specific individuals. If you have a concern about your child's health, be sure to call your healthcare provider. Also, your use of this audio program is subject to the PediaCast Terms of Use Agreement, which you can find at pediacast.org. So let's take a quick break. We'll get Dr. Berkeley Bennett and Dr. Gerd McGwire settled into the studio, and then we will be back to talk about clinical pathways. It's coming up right after this. Dr. Berkeley Bennett is an emergency medicine physician at Nationwide Children's Hospital and an associate professor of pediatrics at The Ohio State University College of Medicine. Dr. Gerd McGwire is a pediatric hospitalist at Nationwide Children's and a professor of pediatrics at Ohio State. Both have a passion for developing and implementing clinical pathways. These aim to improve the delivery of pediatric care and enhance health outcomes for children and teenagers seeking treatment at our hospital. That is the topic today, clinical pathways. But first, let's give a warm PediaCast welcome to our guests, Dr. Berkeley Bennett and Dr. Gerd McGwire. Thank you both so much for being here today.
Thank you so much for having us here today. I'm really excited to chat with everybody about this.
Thank you, Dr. Mike. It's a pleasure to be here.
Yeah, really so thankful that you both were able to take time out of your busy schedules and join us. Berkeley, I wanted to start with you. I think just giving us sort of a broad definition of what exactly is a clinical pathway, and then we'll talk more about why they are important.
Okay, sounds great. So the Nationwide Children's Hospital definition of a clinical pathway is a multidisciplinary plan of care that translates guidelines, evidence, and expert opinion onto local infrastructure and processes. So, that's a complicated sentence. So to explain further, I will use the example of our febrile infant pathways. So as we all know, it's very common for a young baby to get a fever. Most fevers do not lead to serious illness, but we want to make sure that we can identify the cause of the fever while avoiding unnecessary tests and hospitalization. So the American Academy of Pediatrics reviewed 40 years of research to develop a detailed guideline for evaluation and treatment of a young baby with fever. Our clinical pathway program collaborated with local infectious disease experts and frontline providers to combine recommendations from the national guideline with expertise and knowledge of local infections. And we created pathways that clearly outline how to best care for a young baby with a fever at our institution. So pathways are designed to be complete, but quick and easy to read references to help medical teams care for patients in real time. Pathways also call out opportunities for shared decision-making with parents because we want to emphasize the critical role that parents play in the health of their child. So we have pathways specific for our outpatient clinics, our urgent cares, emergency departments, and inpatient units to ensure that the recommendations are optimized for each clinical setting. And finally, not only do pathways promote the best delivery of healthcare, but they standardize the care so that we're providing the best quality to every patient.
Yeah. And I think that from a parent standpoint, there is some comfort in knowing that when you come to our hospital, hopefully for the most part, it doesn't really matter which physician you see, you're going to get the same treatment that's based on evidence most of the time. But the clinical judgment is still going to be important, right? So there are pathways, but they aren't necessarily rigid because there are data points that would make certain kids perhaps an exception, correct?
Absolutely. The pathways are really geared to be for 80% of the people with a certain disease process, but we recognize that there's going to be some that don't exactly fit the mold, and we need to make sure that we are thinking about that and while following the pathway, knowing when we need to step off and do something different.
Yeah. And this is going to be important, as you had mentioned, sort of standardizes care, which is really nice. You can also then change the pathway as new evidence becomes available. So this isn't a one and done, right? You're constantly thinking about the pathways, thinking about the science behind the pathway, and then changing things if our understanding changes. Is that correct as well?
Absolutely. Yes. And I think Yard can speak to this. She's been involved in doing pathways for a long time. We update them every 3 years, but more often, if we learn something new, we're like, ooh, let's make the pathway better because it can better fit the evidence and better care for our patients.
Yeah. And being a teaching hospital, so Nationwide Children's is affiliated with the Ohio State University College of Medicine. And so we do have a lot of trainees who are, they're physicians, they've graduated from medical school, but they're still learning their craft, so to speak. And by having these pathways, I think it does help them start to think things through in a particular way that the rest of us are thinking it. So, it just helps with training, standardizing all of that too.
Oh, absolutely. We try to gear our pathways so that they include enough details for an intern on their first day at the hospital so that they know exactly what to do. And we can all work together to make sure we provide the best care.
Yeah. And sometimes it's good. So when I'm teaching, I like to actually ask the resident first, okay, before we look at a pathway, what do you want to do and why do you want to do it? So there's still room for teaching and for folks to kind of come up with a plan on their own, but then you can sort of check yourself with the pathway to see, hey, am I missing something? Is there a different direction I should have been thinking? But on the other hand, we don't necessarily want to create a cookbook, correct?
Correct. Absolutely.
Yeah. And then what are some of the examples of clinical pathways that we have here at Nationwide Children's?
So right now, we have more than 80 clinical pathways at Nationwide Children's, and they are specific for the setting that the patients are going to receive their care. So our pathways represent a broad spectrum of pediatric conditions, from common diseases such as an ear infection to rare diseases such as infections of the heart. We also have pathways that provide guidance for how to evaluate and manage injuries, how to safely provide sedation so that children don't feel pain during procedures, and for the process of life-saving interventions such as placing a tube in the airway to assist with breathing. We've got the whole spectrum. Pretty much anything you need, we've developed a pathway for.
Yeah. And you're always have your thinking caps on and thinking, okay, what is the next pathway that we could develop?
Yes, absolutely.
Yeah. Now, one thing I love, and the reason that we have both of you on our program today, is we have the emergency medicine perspective and we have the hospitalist perspective. And as we're thinking about pathways, certainly care often gets started in the emergency department. And then if a child is ill enough to be admitted to the hospital, then that care continues as an inpatient. And we want there to sort of be agreement on these pathways and, overall, what is the best for the kid, regardless of if they're in the emergency department or if they're in a hospital room upstairs. So this multidisciplinary approach is really important for clinical pathways. From a practical standpoint, Yard, how does a multidisciplinary team come together and work on these in the best interest of the kid despite different lenses?
Yes, that's a really excellent point, Mike, because I think, as most of us know, modern high-quality healthcare really is a team sport, if you put it that way. When a child is in the emergency room or admitted to the hospital, or even it could be a routine clinic visit, the parent and the child meets nurses, could be pediatrician, or maybe subspecialists, such as a pulmonologist or a cardiologist, and often one or more of many other healthcare professionals we have, such as the dietitians and respiratory therapists, occupational therapists, social worker, pharmacists, psychologists, and so on and so forth. As Berkeley explained, our clinical passage really outline our hospital's best practice, meaning the type of care that is most likely to make a child or a patient improve or recover from an illness or stay healthy. So best practice care is really delivered by each and all members of the healthcare team. So we also need to come together and develop and implement our best practice clinical pathways as a team. And also, as you mentioned, the outpatient, ER, inpatient pathway teams comes together, make sure our pathway aligned so that the transitions between care settings like the ER to the inpatient is smooth for our parents and patients.
Yeah, yeah. I love that pharmacy is involved. They always have a great viewpoint and certainly help us in clinical practice. And I would imagine nursing is also a part of your team.
Very much so. Nurses are the one who deliver a lot of the cares. Doctors might make clinical decisions, but our nurses is truly the front line providers that care for each patient.
And then we mentioned that these pathways are evidence-based. How do you look at the literature? And sometimes literature can contradict itself. You have to really look at how studies were done. Could the methods change the results that you get so that one study might show some different results than another? How do you use the whole body of medical research to come up with a pathway, especially when there might be some things that don't agree with one another?
Yeah, that's another great point. And evidence is really the things that triggered the development of clinical pathways, because the rate at which new evidence, new information becomes available is really tremendous. And it has become impossible for individual doctors and nurses, regardless how diligent they are, to keep up without a hospital providing support. Also, even if you know what the new evidence shows, you need to develop new processes to deliver the new, sometimes very technologically complex treatments to every patient that comes to our hospital. In the past, before clinical pathways were really used, it took about 17 years for a new research evidence to be implemented as standard patient treatment. And even after a national organization publish a guideline, it can take many years until that recommendations reach the patient. So to try to speed up this process, clinical pathways really started to be developed. It first happened in the 1980s to improve the quality and value of care for adults with stroke and heart attacks. Pediatric research has given us many new ways to treat asthma, pneumonia, epilepsy, appendicitis, newborn jaundice, just to mention a few. So about 20 years ago, pediatric providers started to develop clinical pathways for these and other conditions to really make sure that patients receive the benefits of new research findings as soon as possible.
Yeah. And it's easy to see how that happens, where you train, you learn to do things a certain way, you go out into practice, and especially if you're not affiliated with a college of medicine, you don't necessarily have medical students and residents and nursing students, you can very easily get into sort of a rut in terms of how you practice, which served you well back then, but as new evidence becomes available, may not be serving your patients so well today. And so these clinical pathways, we were talking about them in the context of a big hospital and a big pediatric healthcare institution, but even individual private practices could use clinical pathways to sort of standardize care and keep things up to date, even if you just have 3 or 4 doctors in a practice, right?
Absolutely. And our pathways are on our own hospital's intranet site, but also on the internet side for that purpose. And a lot of other hospitals do the same thing because we do want to share and collaborate for all our patients' best interest.
And then what does the implementation process look like? So you get a multidisciplinary team together. You decide that a particular topic is something good to have a pathway for. And Berkeley had mentioned some of the ones that we have here, that there's lots of them. How do you go about then sort of getting that approved through sort of the chain of command of the hospital and then actually getting it implemented into the electronic health record?
Great question. And fortunately, we've had a really great support by our hospital for our program and this whole process to develop clinical pathways. And I think that is a key thing. You can't do clinical pathways without the support of your institution. So the main 3 ways that we use to implement or to facilitate the evidence-based practice is through pathways is by education to care providers, especially doctors and nurses in training, we use electronic or clinical tools that makes it easier to prescribe or order best care than not doing so. And as I mentioned, keeping track of new evidence, our Pathway Develop team, with the help of our great experienced medical librarians, continually search for new evidence, review the new evidence, and discuss if the evidence is really sufficient for us to revise the care that we're providing, meaning will it actually improve the outcome and quality of life of our patients. And if the team think the answer yes, we will revise the care we provide to be even better, and that could be more effective, more efficient, or safer.
Yes. And then in terms of once they are implemented, so we have, you've got your team, it's been approved through the medical director of the hospital, and then we use digital tools to actually manage the day-to-day work of the pathway. For example, if in the electronic medical record, if a kid comes in wheezing into the emergency room, you're going to get access to the asthma order sets and a link to the pathway and all of those things. Then how do you go about reviewing those as new research comes out? So Berkeley mentioned that they are reviewed and reapproved every 3 years. But is there ongoing evaluation as well so that things could be changed sooner?
Yes, absolutely. Each pathway team has expert in that field that the pathway is. So if there's a new research funding that tells us this is something we need to implement sooner, we can update the pathway at any time.
Yeah. And so the febrile infant, for example, if a baby comes in with a fever, you look at how old they are and whether they were premature or not. And then the infectious disease people may say, hey, the American Academy of Pediatrics has these new guidelines. We want to make sure that those are kind of cooked into our pathway, even though we're not at the 3-year mark. But because as infectious disease doctors, they're looking at these things and thinking about it and sort of keeping up to date, they're going to be in a good position to say, hey, we need to rethink this.
Yes, this is absolutely true. And for our asthma care, our asthma pathway, we've almost worked on continuously for the last year. So it's definitely an ongoing process.
Yeah. And Berkeley, in terms of patient safety, how do clinical pathways impact that? It's so important, to keep our patients safe and make sure we're doing the right things. How do clinical pathways help us do that?
That's a great question. And that's something that we really focus on. As Gerd had mentioned, pathways are developed by a big multidisciplinary team. And so the expertise of each team member is critical to making sure patient safety is optimized. An example of this is the emergency department pathway about providing medications to reduce pain during procedures. For instance, if a child comes in to the emergency department with a broken arm and it needs to be straightened, we want to make sure that we reduce pain as much as possible during that procedure. So the clinical pathway utilizes the expertise of doctors, nurses, and pharmacists to provide guidance. First of all, who is safe to be sedated in the emergency department, what medications are safe and effective, and then details about how to monitor and keep the patient safe.
Yeah, so really, we have all of the experience of pediatrics from a national standpoint to really have an idea of what's safe, what's not safe, what are other places doing, what's the latest research. And so by taking all of those things into account, we really are keeping our patients as safe as possible. And it's not only safety, but there's also an efficiency that's comes into play, correct, Berkeley?
Yes, absolutely. So each pathway includes information, on how to recognize and evaluate for a specific condition and how to manage it. And it's all in one document. You don't have to go ask a friend. You don't have to look up in the textbook. It's all right there, everything that you should need. What we've been able to do, which is really fun, is we have a main algorithm that outlines what to do. But then within the algorithm, there's links to separate pages that give you additional information. You can take a quick look, know exactly what to do. But if you're like, I want to understand that a little bit better, you click the link and the information is right there. While each pathway incorporates all this national evidence, we make it specific for a hospital because sometimes you need to know how to navigate care in our own institution. And it includes details on how to do that.
Yeah, so important. And in terms of efficiency too, there may be instances where nurses can go ahead and order something. I'm thinking especially in the emergency department. So if a kid with asthma comes in, we know it's going to be important to get the bronchodilators, things that are going to open up the airways and get steroids going as soon as we possibly can. And that may even be before they see a physician because a particular intervention is on a pathway.
Yes, absolutely.
Yeah. And then, Gerd, in terms of outcomes, we say this is safe, it's more efficient. Do clinical pathways actually impact health outcomes?
Yes, they definitely do. And initially, we just kind of assumed that they do or looked at their own pathways, but now it has been published in lots of studies that they actually do. For example, the rate of side effects and complications that patients might experience decrease when pathways are used because the pathways help doctors, especially new doctors or doctors in training, identify and use the most effective treatments and often avoid using treatments that are not effective but can still cause side effects. Also, as clinical pathways make our care more effective and efficient, like you mentioned, patients recover faster. This means that their stay in the hospital has become shorter, and some hospitals' admissions have been averted altogether.
Yeah, because we're doing what needs to be done more quickly. And so there's definitely that efficiency, and that goes back to the asthma example where if you get the bronchodilators and the steroids started early in their emergency department stay, they may get better before that decision to admit or not to admit takes place. Whereas if they've been there an hour and they're just now getting their medicine to help them and they've already been, sitting around the ER, you're more likely to be like, well, that kid needs to be admitted. They sound terrible and they've already been here an hour, but they didn't really have a full hour to see if that treatment was going to work. So I would imagine that not only is it more efficient in terms of shorter hospital stays, but then that becomes more cost effective as well, because you may not have to have as many resources. You may not be casting as wide of a net in terms of studies that you order, labs, x-rays, those sorts of things. If you're sticking to a pathway and we know it's a safe pathway, we may be able to save money that the healthcare in general is costing us as a society.
Yes, definitely. Healthcare is really expensive, as I think all of us know, especially a stay in the hospital. And I think asthma, like you pointed out, is a great example where we've collaborated actually for the last 10 plus years with emergency room physicians like you in Berkeley, ICU physicians, pharmacists, outpatient provider, and all us inpatient providers to make the care more efficient and costing much less. So it's really about providing the best care at the right time, which, as you said, decreases the time the child has to stay in the hospital. And not only does it decrease the hospital costs, it also decreases the loss of income that parents might experience when their child is in the hospital. So we really work to increase the value of care with clinical pathway, which means providing the highest quality of care at the best cost. And decreasing the use of unnecessary treatment is a very common way that we increases the value of the care we provide with clinical pathways.
Yeah, absolutely. Berkeley, do we find that patients and families, do they realize these pathways are happening, or is it just something that's sort of under the surface? And if they do have an understanding of pathways, does this increase their satisfaction with the care that they're given?
So I think that's a great question. I think a lot of times the pathways are happening and the families may not really be aware of it. It's just part of our efficient way that we deliver care and it's just happening. But there are times when I will bring up a pathway when I'm explaining a treatment plan to a family and I'm able to show them what the evidence says and even engage them in deciding what's best for their child. So by showing them, yes, we've done the research, we have the evidence, we've collaborated, and then including them in visualizing it can really show that everybody can be on the same page about the care plan.
Yeah, and I would think that that's a really important, in the emergency department setting, a lot of times parents come in with sort of a preconceived idea of what may or may not happen, and that may be based on past experiences, and certainly things change, and so maybe we're not doing things exactly the same way that we did before. Or it may be because they've talked to a neighbor or a family friend, or maybe they have a relative who's a physician and, a pediatrician in Oklahoma. And so come in with an idea of what ought to happen. And sometimes that is not the idea that we think ought to happen. And so I think having that pathway is sort of a common ground to discuss what we're doing and why we're doing it, and to hear their concerns, and maybe to say, well, this is the reason that we're not going to do such and such. I mean, it just kind of gives you a concrete thing to carry a conversation around. So I think that's really helpful for both clinicians and families in that sense.
Yes, absolutely. Like I pulled up the pathways in when I'm in the room with a family to show them. We've often printed them out. The families can take time and read them. And I found it to be really valuable.
Yeah, absolutely. And I think Gerd, made the point that you can't know everything, right? I mean, you have to, as new knowledge comes out, we have to look things up, and we have to sort of know what we don't know. And it is so nice just having all that information in one place, so we know where to find it when we need it. And especially some of the disease processes that we don't see incredibly often. I mean, often enough that we understand them and know what to do. But, maybe just as an example, I'm thinking about during the pandemic, we had Miss C, where we would have, very intense inflammation, and it could cause heart problems after COVID. And there was a whole panel of tests that we ought to do. And it's really hard to memorize all of that. And so having it all in one place to look it up, but knowing, well, I know there's a lot of things I need to do. Where do I find that and get that done is just so helpful for efficiency and safety in pediatric practice for sure. One other thing that I wanted to mention is because our pathways are specific to Nationwide Children's, and I know you said they're on the intranet, they're on the internet. So, pediatricians that practice in our community can find them and use them. What happens when there may be a different pathway from one institution to another? Is that something like if I go to Dayton Children's or Cincinnati Children's, am I going to get different care than at Nationwide Children's, Berkeley?
That's a great question. And, really, so many institutions have their own pathway programs and produce their own pathways, and they have their individual processes for doing that. And we often, when we're developing a pathway, we'll look at what are other people doing, just to get kind of a sense. And then we look at the evidence. And so you'll see that there are commonalities amongst pathways at different institutions across the country. What's different is how we navigate the care at our institution, depending on potentially local disease burden or resources, or just how do we do things here based on the expertise at our institution. Those will be the subtle differences. So the care really should be the same, but it's necessary to make it specific for the institution just because that's where you are, and that's going to make it the best care possible.
Yeah. And the other thing too, I think that's important is that there can be, in some instances, a clear, better way of doing things based on evidence. But sometimes there may be more than one way to do something safely, efficiently, because medicine is not always cookie cutter, and there may be more than one okay way to do something. And then you can have differences from one place to another. Would you agree with that?
Yes, absolutely. Yeah. There are different ways of approaching things, different, you can get all the labs up front. You can do it stepwise. It really just depends on kind of the experts in that location and how they feel we can deliver the best care for the people in our community.
Yeah. And it's sometimes things, you may have two different ways of doing something, and one has an advantage in one respect and another has an advantage in another respect. And one of the things that I think about with this is dosing medicines, whether you do it once a day, twice a day, 3 times a day, the fewer number of doses certainly is going to help improve compliance. But when you do smaller doses divided, you're going to get better steady state levels of the drug in the bloodstream so that it's working more around the clock. So sometimes it is a struggle to know which is the right way, because both ways may have their own set of advantages.
Yeah, absolutely. And that's something that when we work with a multidisciplinary team, we talk with, say, the pharmacist and say, okay, what's better? We'd like to decrease how often we're dosing this, but does it really make sense? And we can get a lot of input on that.
Yeah. And that's something that then from one institution to another, you may have a group of pharmacists at one place that put more of importance on one thing versus another, and that can make things change. And so just because you do have disagreements to a degree within pathways, they've still both ways have been thought out by experts, which I think is comforting for parents.
I just want to reiterate what you and Berkeley said. Pathways really are a resource for physicians or providers and parents to get the knowledge what best practice is. But it really is the individual doctor together with the patient and the caregivers who decide how to use the pathway and to decide what is the best care for each individual patient based on his and hers individual situation.
Yeah, I love that so much. The whole idea of shared decision making. And from a parent's point of view, you're always thinking about, okay, what is best for my child? And from the parent point of view, part of what is best for my child is, do we really need to stick them again for a lab value that maybe we don't really need? Whereas the physician is more like, well, I want to do the best thing for the child, and that is knowing what this lab value is. And so sometimes coming together and thinking about risks and benefits and sort of talking it out and making a decision together based on the unique data points of a particular family situation is just so important. And I'm sure that just in and of itself improves patient satisfaction when they feel like they are actually having a seat at the table and are part of the conversation because they love their kid and they want what's best for their child too. They just may have different priorities, right?
Yeah, and getting parents more involved so we can include their experience and opinions is really something that we want to get better on when we develop our pathways. So hopefully more to come on that.
Yeah, absolutely.
Yeah. It's such a great point. And even I love how, like, bringing up our febrile infant pathways, again, we actually have boxes that say shared decision-making with parents because, the evidence, you could go either way. And so we have information about, okay, if your child is diagnosed with a particular virus, are they still at risk for a bacterial infection? And what is that risk? And you can sit down with a parent and say, okay, if, how much risk are we willing to tolerate? Because what we're looking at might be another needle stick, it might be another procedure, and we can make that decision together so that they can really participate in what's best for their child.
Yeah, absolutely. And we are going to have a link to clinical pathways at Nationwide Children's Hospital. So we mentioned that they are available on the internet for anyone to look at. They're not behind a wall. And so we'll have a link to that page in the show notes for this episode. 559 over at PediaCast.org. We'll also have links to emergency medicine and hospital medicine at Nationwide Children's if you'd like to learn more about what Berkeley and Gerd do on a day-to-day basis. So those will be in the show notes for you as well. So once again, Dr. Berkeley Bennett with emergency medicine and Dr. Gerd McGwire with hospital medicine, both at Nationwide Children's Hospital. Thank you so much for stopping by and chatting with us today.
Oh, thank you for having me. This has been really wonderful.
Thank you very much for this opportunity to talk about clinical pathways, our passion.
We are back with just enough time to say thanks once again to all of you for taking time out of your day and making PediaCast a part of it. Really do appreciate that. Also, thanks once again to our guests this week, Dr. Berkeley Bennett with emergency medicine and Dr. Gerd McGwire with hospital medicine, both at Nationwide Children's Hospital. Don't forget, you can find us wherever podcasts are found or in the Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, YouTube, and most other podcast apps for iOS and Android. Our landing site is PediaCast.org. You'll find our entire archive of past programs there, along with show notes for each of the episodes, our terms of use agreement, and the handy contact page if you would like to suggest a future topic for the program. Reviews are helpful wherever you get your podcasts. We always appreciate when you share your thoughts about the show, and we love connecting with you on social media. You'll find us on Facebook, Instagram, Threads, LinkedIn, and Twitter X. Simply search for PediaCast. You've listened to this program. We have another one, actually, called PediaCast CME. That stands for Continuing Medical Education. It's targeted for healthcare providers. So if you take care of kids in any capacity, that program is for you. It's similar to this one. We do turn the science up a couple notches and offer free continuing medical education credit for those who listen. And that includes physicians, of course, but also nurse practitioners, physician assistants, nurses, pharmacists, psychologists, social workers, and dentists. And since Nationwide Children's is jointly accredited by all of those professional organizations, it's likely we offer the exact credits you need to fulfill your state's continuing medical education requirements. Of course, you want to be sure the content of the episode matches your scope of practice. Shows and details are available at the landing site for that program, pediacastcme.org. You can also listen wherever podcasts are found. Simply search for PediaCast CME. Thanks again for stopping by, and until next time, this is Dr. Mike saying stay safe, stay healthy, and stay involved with your kids. So long, everybody.
This program is a production of Nationwide Children's. Thanks for listening. We'll see you next time on PediaCast.